Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Reinier Schuur, and joining me for the first episode of the show is my friend and colleague, Caspar Safarlou. Caspar, thank you for joining me.
Thank you for having me, Ray.
Now, for most episodes, I will be the one doing the interviews. But for our first episode, Caspar will be interviewing me so that our audience can learn a little bit more about me, how I got into health policy, and learn about AFCAM, and learn about the purpose of this podcast. And with that, Caspar, fire away.
Thanks. So I'll be asking you about AFCAM and about the podcast. But first, I wanted to know, how did you get into health policy?
So I never envisioned that I would be working in health policy. And to understand my journey, we'd have to go back to the beginning. So when I went to college, I had an interest in philosophy. I was interested in philosophy because I believed in the power of ideas. I wasn't just interested in ideas as something to read about in a book and think about. I was interested in the power of ideas and how it can affect our lives and the broader world. I also had an interest for that same reason in religion and theology, because that is one way to live a life of ideas and values and norms. But another way in which ideas shape our lives and our world is through science. Science is an embodiment of certain ideas. So I also had a very keen interest in the philosophy of science and different philosophical issues that affected different sciences, in part because science is exciting, progress is exciting, understanding the world is exciting. They give us knowledge of the world, but also new technologies and new ways to improve the world. And one of the sciences that I got more interested in throughout my undergraduate studies was psychology, in large part because there's still a lot of work to be done in psychology, understanding the nature of consciousness. My initial interest was in the mind-body dichotomy and free will. I wrote my undergraduate dissertation on the intersection of philosophy and cognitive science on the issue of free will. And the way that I envisioned my career was as a philosopher who could help other productive fields be productive. In large part because I recognize that the kind of ideas that underlie the fields can make the field worse or better. So I wanted to help fields which I thought had not necessarily bad ideas, although sometimes that's the case, but unhelpful ideas. And to put it positively, you want better ideas in order to clarify your thinking. And the way that I was thinking about this in particular was how to think about human agency in the context of psychology, and in particular, the role of norms and values. So I, in that sense, already had a pretty early interest in the normative aspects of psychology, not merely how the mind works, but how it should work so that we can have better lives. So after my undergraduate study, I went to King's College London. I was doing a master's in philosophy of psychology, which was really interesting. But halfway through, I noticed that that master's program in particular didn't really focus on the normative aspects of psychology that much. And so I switched to a different master's, which was in the philosophy of psychiatry. And I got interested in that because the philosophy of psychiatry is much more focused on questions of norms and how the mind should work with regards to mental health, right? So there's already my interest in mental health and health more broadly, in large part because philosophy of psychiatry, which overlaps quite a bit with philosophy of medicine, is a normative field because medicine and psychiatry are normative fields. And my interest initially was in metaethics, the fact-value dichotomy in medicine and psychiatry. And after I finished my master's, I decided to continue in my interest in the philosophy of medicine and psychiatry by doing a PhD in it. And I focused on issues of free will and norms, and I focused on addiction as a case study to more deeply understand how people were thinking about free will in the context of psychiatry and medicine more broadly. In large part because there's a controversy there, and it has been for decades. Is it a disease? Is it an issue of moral character? What is the role of free will in certain psychopathologies? But slowly I started to realize that the kind of work that I wanted to do to help a productive field like psychiatry and medicine, I couldn't really do in academic philosophy. And I'll just give you a basic illustration of this. So, one thing that I noticed was that a lot of philosophy of medicine was very much defensive and didn't really play a big role in helping doctors and psychiatrists think about the work that they were doing. You would have doctors, psychologists who are interested in the philosophy of medicine, in the philosophy of psychiatry, in the philosophy of psychology. And some of them do use it to improve their work, but it's pretty rare. And I think it's in part because the nature of these fields is very academic in a very specific sense. There's all sorts of academic fields that interact very closely with their correspondents in industry and the market, like engineering, for example. But that was not the case for philosophy. It is a pretty unique thing to be able to work with doctors and psychologists on projects where philosophy and psychology intersected, and I did that, and it was very rewarding. But I noticed that there's a tendency in academia in general to get lost in the arguments. Much of academia is about trying to convince a small group of people about a certain position. Now, that has a certain place in the world, and people that like doing that, I applaud them, and they should go ahead and do the best that they can. But that's not how I envisioned it, or at the very least, I learned that that's not really the kind of work that I really enjoyed. And so then I started looking around, like, what are other ways that I can help medicine and psychiatry and these other productive fields be productive? And one way that I started to envision a different path was throughout my studies, I noticed other ways in which these productive fields were affected by bad ideas and could benefit from good ideas. And it wasn't not necessarily in the form of changing certain theoretical frameworks, but it was through the realm of policy. So one example that I noticed in my doctoral dissertation was ways in which, for example, the government influences research. So one aspect, one area where I did research was in psychiatry and rather the frameworks for research. And I noticed, for example, that something like the DSM, which was created for primarily billing and diagnostic purposes, which was never intended to be used as a framework for research, nevertheless frames a lot of research, in large part because in order to get research funding in psychiatry and psychology, you need to reference a DSM category. Even though people recognize that these categories are not necessarily scientifically useful. And I just found that fascinating and uh, pretty strange. Like, we recognize that these categories are not that helpful for research purposes because they might capture different disease entities that might overlap with others in ways that might be useful for clinical purposes and billing purposes. But it might turn out in the future that a lot of these categories are going to change based on the research. But we wouldn't know that if the research is constrained by them, right? So that's one area. Another area is in the area that I was already interested in, which was understanding human agency, in particular in the case of addiction. I noticed, for example, that there was a whole campaign by the NIH to reconceive of addiction not simply as a disease, which was already regarded in some broader sense as like a disorder, but as a brain disease. And this was in part sparked by new technologies like fMRIs and whatnot. But fundamentally, part of the motivation was to convince the public and, in particular, Congress to increase funding for addiction research, because the view was that research is underfunded because people see it as a moral issue, and so we have to disabuse people of that view. There's also the argument that it stigmatizes people to not see it as a brain disease. And I found that fascinating too, because it means that, and it's been a pretty common criticism of the research in addiction that funding is prioritized for particular models of addiction, which don't necessarily bear the best explanations or outcomes for patients. I was seeing all sorts of ways in which government and policy was influencing the field of medicine, how we think of certain diseases, and how it affects progress. And I found that fascinating, and I thought like, well, that's definitely a more kind of direct way that I could be involved in improving these fields. And another way that I got interested in this was through my wife, who's a physician herself. And we met in graduate school. And while I was nearing the end of my PhD, she was finishing her MD. And she went through the match, which, if people don't know, is this system of getting people from medical school into a residency program in a pretty bizarre system where the recipient ranks programs rank you, and wherever you end up going is where you go. You sign a contract. It's very hard to back out. And the only other job that I know of that has this kind of system is the military. And my wife and I, like, I mean, she knew this was coming, but I thought like where does this come from? You know, it's like why do doctors have to go through this bizarre match program, which is unlike any other kind of interview process of any other industry? And I got interested in the history of that. And so slowly but surely, I got more and more interested in helping productive fields be productive, not through academic philosophy, but through policy. And I had a particular conception of that. My interest in doing that was not to get into the weeds on policy. I mean, I can get pretty bored reading just pure health policy. I can get pretty excited about it if I understand that there's a deeper idea at issue that is worth fighting for. I'm motivated to develop and present the best policies to the extent that they embody the best ideas. So that's how I got into health policy as a topic. The way that I got into AFCAM, which you can ask me about in a bit, is I organized a conference on health policy called Desocializing American Medicine at the University of Texas, which was a lot of fun to do. I met a lot of great people. And after that, I was essentially offered a job to take over and revive Americans for Free Choice in medicine. And that's why I'm in the position I am right now.
Yeah, that's great to hear. And so, what binds together all these examples that you mentioned on the DSM and addiction and the story about your wife at the residency programs is policy and the way in which we not just organize science, but also science funding, as well as these policies that surround the way in which we train future doctors. And so I was wondering, I know you have a particular model in mind for this. What do you see as a good example of the role of ideas that underlie these different types of policies? How did you, in your mind, make the switch of, okay, this is something that I want to do, I want to do work on?
Yeah, that's a great question. One perspective that I have is that in order for all fields to be productive, is to be free to produce and to pursue progress. It's the freedom of the mind that makes possible progress. And one moment which helped me concretize this and how I could apply this to medicine, which I've failed to mention and played a pretty big role, was recognizing other people playing that kind of role for other fields. And the pivotal example for me was Alex Epstein. For people who don't know, Alex Epstein is an advocate for freedom in energy policy, and he defends the fossil fuel industry in particular because they are very often under attack. And I found that very inspiring and motivating, in large part because the fossil fuel industry is a productive industry and they are morally maligned all the time. And you see that in medicine too. You see the pharmaceutical industry being maligned, doctors being maligned, insurers being maligned, even though they are incredibly productive, especially when they're free. And so that's what Alex helped me to do, was see that I could do that for medicine. And I already had an interest in medicine. And that really inspired me to think of myself as someone who advocates for people in the healthcare industry, not simply because, like, oh, well, this particular policy will make this a little bit more efficient, but to advocate for them in a more fundamental way, namely their rights to use their minds to create new values, to trade with other people freely as well.
And how does that connect to Americans for Free Choice in Medicine, to AFCAM? Can you tell me a bit about the organization, its origins, and what its mission is?
Americans for Free Choice in Medicine, which is AFCAM for short, was founded in 1993 in response to the Clinton health plan. Now, the Clinton health plan, in many ways, used the language of the free market to sell itself to the American people. But the American people weren't buying it. They recognized, and doctors recognized, that it would have represented a major increase in the role of government into healthcare. And AFCAM was fighting that. The Clinton plan was defeated. But AFCAM was not merely created to defeat this plan. And it was not merely created to defeat socialized medicine or government involvement in medicine. It was created in large part to offer a positive alternative, which in many cases was missing back then and now. And in fact, in many ways, the reason the Clinton health plan failed was despite there not being an alternative. And in particular, that alternative is not only a free market in medicine, but a moral defense of a free market in medicine. There was a recognition back then that the only way to fight against government intrusion in healthcare is to offer a moral alternative. That alternative being a free market, based on the recognition that people have an individual right to produce as they see fit and consume as they see fit in healthcare.
A moral defense as opposed to what?
What distinguishes AFCAM from other organizations is precisely that, namely, other organizations, many of which provide real value. They provide good, solid economic arguments for the case for free markets in medicine. That's great. The problem is it's not sufficient. And if you only did that, then you're going to lose. And I think that's why we've seen free markets in medicine eroding for decades. What distinguishes AFCAM from these other organizations is providing a moral argument for free markets in medicine, and in particular, doing it not merely as, oh, well, this is what's good for society, this is what's good for everyone, which is true, it would be good for everyone. But we also want to make clear that freedom in medicine is not simply good for everyone, it's good for you. It's good for doctors, for insurers, for innovators in the industry, people who are incredibly productive, intelligent, talented people who derive incredible meaning from their work. Meaning in creating new values, in trading with others, in a vision of what health could be, especially given that health is a real achievement of the modern era and being a part of that noble tradition, giving voice to that. And so not merely a moral defense, but also a personal defense of the values that are worth fighting for and that require freedom.
Right, an individualist defense of
Yeah,
those values.
that's right. Exactly.
That sounds really exciting. And what do you see as the role of AFCAM in providing such an individualist defense of healthcare and the pursuit of all these personal values that are so meaningful to these innovators, producers, and doctors?
The way that AFCAM sees its role in creating a future of more freedom in healthcare is the recognition that we need a movement for freedom in healthcare. And one thing that that movement needs, which I've already mentioned, is a moral defense of freedom in healthcare. And that's what we see our role as being, as primarily playing an educational role, educating people about the moral case for free markets in healthcare, how to conceive of their own personal values in moral terms and why freedom is required for it. And not only giving people the voice to defend their own values, but the ability to trade with others. Because that's a big problem in the healthcare system is it's not only fragmented, people are at each other's throats. They see each other as the enemy. It's doctors versus insurers, insurers versus pharma, pharma versus patients, everyone versus everyone. Our vision of freedom in healthcare is not merely freedom for doctors, it's for everyone to be able to trade and create new values with each other. And that's the role that we see ourselves as playing is providing a moral voice to certain values that require freedom and certain relationships that require freedom, and to help people conceive of them in those terms and to build a community around it.
So I was wondering if you could tell me how this podcast fits into the mission of AFCAM. What need is it trying to serve?
So the purpose of The Pursuit of Health, which is the name of the podcast, is to give people in the healthcare industry and those who support and admire them the words and the vision to defend their values. And that's pretty broad. Let me concretize that just a little bit for you. There are all sorts of people in the healthcare industry who, as I mentioned, are very productive, very hardworking, who very easily could work in other industries, be better compensated, if not better compensated, more respected. And yet they stay in this industry despite being maligned. And even if they're not being maligned, they have to put up with a lot. They have to put up with all sorts of regulations, and it can be really difficult to thrive in this industry. Nevertheless, people do manage to thrive. And part of what the podcast is trying to do is give voice to that, to tell people that even though things are bad, the pursuit of values, the pursuit of health as a good, whether you're producing it or researching it or consuming it, is still possible. And what that is supposed to motivate in people is a conception that, yes, it's a good. It is good that people are still able to find meaning in it, and we want more of it. So it's also trying to change the kind of normative framing around the case for freedom in healthcare. Whereas very often I find people who advocate for freedom in healthcare are very often motivated by a negative. If we don't advocate for freedom, the government's going to take over. It's going to be terrible, which is true. And it would be terrible. But you can't simply be motivated by a negative. You have to recognize the positive, and those positives have to be framed not simply in moral terms, as I've already explained, but in personal terms. There are real people with real careers creating real values that are worth fighting for. And the way that I see it is that in the context of this podcast, there's two ways that the podcast can help do that. One of them is sharing people's stories of how they still manage to pursue value, pursue health as a good under the current system, how they've been able to do that, navigate that, both in terms of career decisions and like what certain ideas helped keep them going and motivated them and gave them inspiration and courage. And hopefully that can help other people and create a community where people feel supported. Another way that can be done is by having on certain experts. And the way that I envision that is I want to have experts on in order to provide essentialized knowledge so that people in different parts of the industry can arm themselves not simply by being inspired by other people's stories, but by having the best knowledge, the best arguments to defend themselves when it comes to certain policy changes that they are facing, or if they themselves want to be part of advocating for certain policies in a certain campaign. That's the role that we see ourselves as providing, is educating people so that they themselves can advocate for themselves. And that's the basic idea of the podcast and helping other people in their pursuit.
I love the idea and I look forward to listening to the podcast myself. But I also wanted to ask you, what other work are you doing at AFCAM and what do you want to tell audience members about all the work that you're doing?
Yeah, so this is my own story of my pursuit of health, not so much as a product, but as a idea that I'm fighting for, the freedom to pursue health as a product. And there's lots of exciting ideas to be working on and many ideas that excite me. There's really a lot of work to be done in this area. And I just want to highlight two of them, two parts of the healthcare industry that have been repeatedly under attack, especially so over the last year or so, is the health insurance industry and the pharmaceutical industry. And what I'm currently working on is on working people in those industries to not only tell their stories, but to defend those industries. And there's many ways that I conceive of doing that. One of them is understanding the history of these industries themselves and how they provide value and how their pursuit of value is hindered, not simply by regulations, but the ideas behind the regulations. And so that's what I'm working on. I'm working on helping people understand the value that the health insurance industry, despite how much it's constrained, how they're still able to provide value to people, and that a lot of the disvalue in people's interaction with the insurance industry are due to things beyond their control. People don't recognize that the products and services that they sell, in many ways, aren't their own. They have very little control over what they're selling. And I regard it as a major injustice to blame the insurance industry for selling a suboptimal product when it's the regulations that make them suboptimal. So that's one thing that I'm working on. Another thing that I'm working on is defending the pharmaceutical industry, which is just, if you understand the history of the pharmaceutical industry and modern pharmaceuticals, is a really interesting industry, considering how poor health used to be and how much they've improved it. And what is interesting is that the kinds of critiques that the industry has faced has started to shift in ways that are troubling, but also represent an opportunity for myself and Afghan. I just want to sketch this out for the audience. The kind of criticism that the pharmaceutical industry used to get, and still does, is that pharmaceutical products are amazing, but the people that produce them are, we regard them with suspicion, or they're even immoral, right? And that it's based on the view, for example, that, well, the pharmaceutical industry isn't really behind the innovation, it's government research. They just take the research and rip us off, right? They overcharge us for research we already funded. So the basic idea for a very long time was that pharmaceutical products are good, and the producers of the pharmaceutical products, namely the pharmaceutical industry, is bad. And that was the flavor of the attack on the industry, which I regard as supremely unjust and something where we have to set the record straight. What
Hmm.
what has happened recently is not merely an attack on the pharmaceutical industry, but attacks on pharmaceutical products themselves and modern medicine as well. It's still fringe, but it's growing. And you see this in, for example, the Make America Healthy Again movement, RFK at the helm at HHS. There's a growing mistrust in not simply modern medicine when it comes to the authorities, but modern medicine as such, right? The role that it plays in our lives, how it improves our lives. And you see all sorts of claims being made that are either misleading or just simply untrue. Saying, for example, we've never been sicker before, and it's because of the pharmaceutical industry. Their products are making and keeping us sick. Now, it's true that we're facing new and unique health problems that we haven't faced in the past. But there's a failure to recognize that a lot of these problems are problems of abundance, right? Too much food,
Hmm.
too much of certain kinds of food, right? Changes in infrastructure, right? When I'm in the Netherlands, I walk everywhere because that's how the towns are built. Whenever I'm in America, I notice I gain a little weight because walking and cycling isn't part of my routine as much. And that's because there's big cities in America. So there's all sorts of ways in which people's thinking about health in the context of medical innovation is incredibly warped. People don't understand how health is a modern achievement. There's this conception that if we just go back, things will be better with regards to our health.
And so there's not just misinformation there on the state of modern medicine and modern technology that you want to battle, but there's also a moral perspective that you have on this, right?
That's correct. So it isn't simply that the pharmaceutical industry provides us with great products and that health is good in some kind of generic sense. Health is good because health is personal and it's your life. And what the pharmaceutical industry helps us do is to achieve better and better health, to pursue health. And they are doing that in ways where they're using their minds, produce new values to take on the challenges of nature and of continual human needs. For most of human history, we were at the mercy of disease. And even as we progress, there are new health needs that emerge because of progress. One example being people being addicted to their phones. And the normal perspective there is that it's because of technology that we're becoming less healthy with regards to mental health. I have a very different perspective on that. All these technologies provide supreme new values and create new needs for new values. And you see this in all sorts of ways in which you have all sorts of new health and medical interventions to help improve our mental health. They could be better. They could be much, much better. But that's how we get healthier is through more and more technology used in different and more creative ways.
So what do you think about the claim that the healthcare industry makes money from us being sick?
Well, it's a claim that gets floated around all the time, and it's supremely wrong. There's just the simple basic economic fallacy at play here in that the way that the industry makes money is by making people healthy. Otherwise, their products wouldn't sell. But even this broader view that if it turned out that, oh, we didn't have a epidemic of obesity or all these other health issues or chronic health issues, that the industry would not be able to make money. That's just a complete misunderstanding of the role of the industry and the nature of health. Health is not some natural state that we have to go back to. It's quite the opposite. Humans are naturally unhealthy for most of human history. We're like
Hmm.
very unhealthy, very not just short lifespans, but like by God, the kinds of diseases and afflictions we had, it required human, which means technological intervention on our state of being to make us healthy. And what the pharmaceutical industry helps us do is to become unnaturally healthy, right? By historical standards, unnaturally healthy. And that's how they create value. And even, I don't know, like we cure cancer, we cure diabetes. Let's say we're much healthier as a species than we are now. Health is a continual value. There's all sorts of ways in which health is not something that once we achieve it, it's permanent. And there's all sorts of personal aspects to health. I mean, think about, for example, the huge industry that goes into all sorts of aspects, for example, of exercise and weightlifting and longevity and all these. Health is not simply the absence of disease, right? Health are all these other positive values, such as our sleep, our diet, our levels of energy, and those needs are infinite. And this idea that the industry is purely reliant on profits because we are sick, it's just simply you are not understanding health as a value and the value of health as something that commercial interests have very good incentives in providing us value for.
That's a great answer, eh? Well, I'd like to thank you for this interview, and I look forward to seeing more of your work.
Thank you. Till next time.
Till next time.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.